Good morning, everyone, and thank you for joining me today. Our presentation is titled Legal and Ethical Implications of End-of-Life Decision-Making. We'll be exploring the complex challenges and important considerations that healthcare professionals face when making decisions at the end of a patient's life. This is a deeply sensitive and vital area in clinical practice, and I look forward to discussing the key issues with you. Let's begin. On this slide, we're looking at some of the most important types of end-of-life decisions. First, advance directives are legal documents where a person clearly states their preferences for medical care, especially if they can no longer communicate their choices themselves. Then, we have living wills, which are more specific instructions about the kinds of treatments or interventions a person wants or does not want at the end of their life. Next, do not resuscitate orders, or DNRs, are medical orders that stop healthcare providers from performing CPR if the person's heart or breathing stops. Finally, life-sustaining treatment choices involve decisions about whether to use or withdraw treatments like ventilators or feeding tubes that prolong life. Each of these plays a crucial role in respecting patient wishes and guiding medical care during difficult times. You can see how the icons help visually represent each concept, tying the information together clearly. Here we see the relative influence of different legal layers on end-of-life care displayed through this horizontal bar chart. State laws have the highest impact, rated at 100, indicating they play the most significant role in shaping clinical decisions at this stage. Both federal statutes and institutional policies show an influence level of 60, highlighting that while important, they are somewhat less dominant compared to state regulations. Understanding these layers is crucial because they collectively guide healthcare providers and institutions in delivering care that aligns with legal requirements and ethical standards. This interplay ensures that end-of-life care is both compliant and respectful of patients' rights. Here we have 4 key ethical principles that guide decision-making at the end of life. First is autonomy, which emphasizes the patient's right to make informed choices about their own care. It's crucial that we respect and support patients in expressing their wishes about treatments and interventions. Next is beneficence, the duty to act in the patient's best interests. This means that all care decisions should aim to enhance the patient's quality of life and provide genuine benefit. Then there's non-maleficence, or the obligation to avoid harm. We need to be careful to prevent any interventions that might cause unnecessary suffering or injury. Finally, justice ensures that healthcare resources are distributed fairly and equitably so that every patient has equal access to appropriate end-of-life care. Together, these principles form the foundation of compassionate and ethical care during this sensitive time. Here we have an introduction to the Patient Self-Determination Act, which was enacted in 1990. The main purpose of this act is to promote patients' rights, specifically their ability to make informed decisions about their own medical care. It requires that patients are provided with clear information about advance directives, legal documents that outline their preferences for medical treatment if they become unable to communicate those wishes themselves. This legislation plays a crucial role in empowering patients to take control of their healthcare decisions well in advance. This slide focuses on the key requirements and provisions of the Patient Self-Determination Act. First, facilities must inform patients about their rights and advance directives. This means explaining what options patients have regarding their care and providing clear written materials when they are admitted. Second, it's crucial to document any advance directives properly in the patient's medical record. For example, if a patient has a living will, this should be noted in the electronic health record to ensure all care providers are aware. Finally, staff education is essential. Facilities need to conduct regular training sessions so that all staff members understand the policies and can support patients effectively. These 3 areas, informing patients, documenting directives, and educating staff, are the foundation for complying with the Act and respecting patients' self-determination. Here we see the impact of the PSDA on healthcare practice over a 20-year period from 1985 to 2005. The line chart illustrates 2 key trends: the advanced directive documentation rates and patient understanding rates. Starting in 1985, documentation rates were essentially non-existent, while patient understanding was very low, around 5%. However, as the years progress, there's a significant and steady increase in documentation rates, reaching almost 98% by 2005. Patient understanding also improves, though more gradually, rising to about 40% by the same year. This data clearly shows that the PSDA contributed to a substantial increase in formal documentation of advanced directives, and it also helped enhance patients' comprehension of these directives, reflecting an overall positive shift in healthcare practices related to patient autonomy and informed decision-making. Here we explore the delicate balance between patient autonomy and medical ethics. First, patient autonomy emphasizes that individuals have the right to make informed decisions about their own care. It's crucial to respect their values and preferences, as this empowers them and honors their personal dignity. On the other hand, medical ethics require clinicians to act in the patient's best interest, promoting beneficence while avoiding harm. Professional judgment plays a key role in guiding ethical care, ensuring that treatment decisions are both compassionate and responsible. Together, these principles work hand in hand to create respectful, effective healthcare. When it comes to end-of-life decisions, one major challenge is the variability of state laws. Because laws differ so much from one state to another, it can create a lot of uncertainty and confusion for families and healthcare providers trying to make the right choices. Another significant issue we often encounter is surrogate disputes. These occur when the appointed decision-makers, those trusted to make decisions on behalf of the patient, disagree among themselves about the best course of action, which can complicate and delay care. Finally, in some cases, conflicts escalate beyond personal and medical disagreements and move into the legal arena, involving court proceedings to reach a resolution. The image of the gavel here really captures the authority and seriousness of these legal challenges that can arise during such sensitive times. Here we explore the distinct but interconnected roles of patients, families, and healthcare providers. Starting with the patient's responsibilities, it's crucial for patients to clearly communicate their wishes and actively participate in end-of-life decisions. This includes documenting advance directives and expressing their care preferences to ensure their intentions are understood. Moving to the family or surrogate role, their job is to support the patient's decisions, relay patient preferences when needed, and maintain clear communication with the care team. Acting as advocates, they help ensure that the patient's voice is effectively represented. Lastly, healthcare providers have a duty to provide clear information and guidance on care options. They must respect input from both patients and families and facilitate open, respectful discussions. Together, these roles create a collaborative environment focused on compassionate, patient-centered care. Here we have 3 case studies that highlight different aspects of end-of-life decision-making. First, we see the importance of having a clear advance directive. In this example, a patient's wishes were explicitly documented and legally supported, which ensured their care decisions were respected without dispute. This really showcases how thorough planning helps avoid confusion. Next, there was a situation involving a disagreement between family members and healthcare providers. This conflict was resolved through mediation, where legal standards helped clarify who held surrogate authority and guided the resolution process. This case underlines the critical role mediation can play when there are conflicts about someone's care. Finally, an example of unclear documentation led to court involvement. Because the patient's wishes were ambiguous, the court had to step in to decide what was in the patient's best interest. This emphasizes how crucial it is to have clear, detailed documentation to prevent prolonged legal battles and ensure that care aligns with the patient's true desires. Together, these cases demonstrate that clear, well-documented directives and effective dispute resolution mechanisms are essential to respectful and appropriate end-of-life care. These core principles help us navigate the complex and often sensitive clinical situations we encounter. Clear and accurate documentation, combined with open communication, is essential. This not only supports ethical and legal compliance, but also promotes shared decision-making and ensures continuity of care among healthcare teams. Finally, System-level actions are vital. Institutions should implement policies and provide training to foster ethical practices and legal adherence. When healthcare systems work together on these efforts, patient outcomes improve and accountability is strengthened across the board.